Welcome back. Well, when it comes to washing hands and not touching faces, it can be really hard for kids to remember all the necessary guidelines that come with that, even for adults, actually. Here to talk with us about some helpful tips is Nathan Heffington, who is a nurse practitioner with Parkside Pediatrics. Thanks so much for joining us, Nathan.
Hey, thanks for having me.
Now, are you seeing a large number of people coming in with COVID concerns and symptoms?
We really are. That was just kind of increased over the past couple weeks. Coronavirus COVID can look like so many different things in kids and have so many different symptoms. A lot of people are coming in with concerns and questions, and we're testing a lot of people.
Absolutely. And if a child does get sick, even with those cold symptoms and maybe flu symptoms, would you recommend that they go ahead and get tested?
Yeah, I think so, because, like I said, it can look so different in kids. I mean, it can be from a runny nose to diarrhea and, kind of a stomach bug thing to flu kind of symptoms to feeling really bad and really sick. And so it's important, I think, that they get tested, not even as much for their own safety all the time, because a lot of kids do really well, but for the safety of those around them, so they don't pass it on to somebody who is more medically fragile or continue to spread in the community.
Absolutely, is definitely. Tests might be a little bit scary for kids. Any advice on how to prepare them if they do actually have to get a test?
Yeah, I guess a little bit. I mean, it can be a kind of invasive test. Most of the tests we call nasopharyngeal, so it goes kind of into the nose and back into the throat. So it's not something that kids super love or get excited about. So with older kids, you want to kind of talk to them and kind of pump them up for it and let them know what's coming. It'll be over quick. With little kids, you probably don't want to mention a lot of the specifics too far in advance, like on your way to an appointment, because they'll just work themselves up and get this. But it is nice, the ones that go easier are the ones that they've been promised something afterwards. Like a Chick-fil-A milkshake will smooth over something being shoved up your nose pretty quickly. So
that always helps me too, Nathan. Do you all receive the test results? If so, would you say that there's a large number of cases that you're seeing right now, or is it lower? What are you guys seeing?
Yeah, so we do get the results. The results come from the lab to us, and then we talk to the patients. It's really important for us to be able to, when there's a positive, for one of our trained staff or one of our providers to be able to call and talk through that with the family and what that means for them and what that means for their family members and people they've been in contact with, because it's so important to control. But we have seen a definite increase in the number, but also sort of the percentage of positives. So at the beginning, it was a very small percentage of the people that we tested were positive, and in South Carolina and in our practice. But now that percentage has risen, and it's much more easy. We get multiple positives every day.
I bet that's what the statistics are showing as well. And with these positives that you're seeing, is it being spread among family members and exposure through other kids or activities, or do you kind of know where it's coming from in these little ones?
Yeah, that's a really good question. It's something that's been talked about a lot kind of in the media lately, and there's been some studies on transmission from kids, and a lot of the data seems to show that kids are less likely to spread it to adults and to other kids. It usually comes from an adult. And I think that's mostly what we've seen, but we've also definitely seen it go from kids to other kids or kids to adults. It's not something that can never happen. We are seeing it spread through families, in households pretty significantly, which that can be really detrimental, when one member of a family gets it, and it's kind of, then it slowly works its way through everybody else, because there's that has quarantine implications and going back to work implications, and so it can be really hard when it spreads through a whole family. So especially for our big families, with 5 or 6 kids, it's really important to do everything you can to prevent it, prevent acquiring it, and prevent spreading it, so that it doesn't work its way through your family.
Absolutely. All very helpful information there. Thank you so much for joining us this morning, Nathan, and stay safe out there.
Thanks. You too.